Upper arm, elbow, and forearm acute or traumatic conditions. The conditions that we'll cover include contusions, sprains, and dislocations.
An elbow contusion is also known as a bruised elbow. It is a condition in which a person has injured the tissues overlaying the elbow, resulting in a bruise and pain over the elbow. The cause of this is commonly a fall or a direct force to the elbow, such as which happens in a bike accident or impact from a hard ball while playing sports such as hockey. Symptoms of elbow contusions or bruised elbow include instant pain on the direct force or impact to the elbow, appearance of a bruise or discoloration of the skin surrounding the elbow, tenderness to touch, swelling may be present, limited or painful movement of the elbow. Symptoms indicating a more serious condition are extreme pain upon elbow movement, which could potentially indicate a fracture. Treatment options for elbow contusions or bruised elbow include resting the arm. The arm should be kept elevated. Compression bandage may be used to decrease the swelling and bleeding. Ice therapy also helps reduce swelling and bleeding. NSAIDs and a sling can be worn for comfort and to limit the movement to promote healing. If the elbow is extremely painful, then a fracture may be indicated and the patient should seek medical attention right away. A sprained elbow is a type of injury affecting at least one of the ligaments within the elbow. Each ligament is a strong band made up of tissue responsible for connecting the bones together and forming its joints. If a ligament becomes injured, it may be partially or completely torn or stretched. Any sprain affects the ligaments immediately around the joint, meaning that those experiencing an elbow sprain have torn or pulled at least one or more ligament within the elbow joint. A sprained elbow can happen at any time the arm is twisted or bent into an unnatural position. It may also occur when the ligaments become overloaded during movements, even when those movements are regular in nature and have occurred before without injury. Other causes of sprains can include twisting of the forearm in a forced manner, falling onto an arm which is outstretched, receiving a blow to the arm. Common symptoms accompanying an elbow sprain include pain when the elbow moves, pain, swelling, and tenderness around the elbow, warmth, bruising, or redness around the elbow, and possibly limited mobility of the elbow. Any time that you hear a pop sound at the time of injury, inform your athletic trainer, physical therapist, or doctor, as this may indicate a torn ligament. As long as the person receives proper treatment and care, most people completely recover from a sprained elbow within 3 to 6 weeks. The management of an elbow sprain depends on the severity. We price if it is grade 1, and we refer if it's a grade 2 or 3. Tommy John surgery is more properly known as ulnar collateral reconstruction, or UCL surgery. It is a surgical operation in which the ligament on the medial elbow is replaced with a tendon from elsewhere in the body, often from the forearm, hamstring, or foot of the patient. An elbow dislocation occurs when the bones of the forearm, like the radius and the ulna, move out of place compared with the bone of the arm, or the humerus. Specific serious injuries that can accompany elbow dislocation include breaking the bones or fractures, injuries to the arteries of the arm or the vessels carrying blood to the hand, and injuries to the nerves that run along the elbow area, impairing movement and feeling in the arm and the hand. The cause of most elbow dislocations is usually a fall, most commonly with the arm extended completely. However, any traumatic injury, such as a car crash or a fall during skiing, can result in an elbow dislocation. Nursemaid's elbow is a particular type of elbow dislocation that most commonly occurs in young children who have had an abrupt yanking of their forearm. This results in a dislocation of the head of the radius at the elbow. It is common in children less than 5 years old. Elbow dislocation signs and symptoms. Severe pain in the elbow, swelling, and inability to bend the arm are all signs and symptoms of an elbow dislocation. In some cases, people may lose feeling in their hand or lose a pulse. Arteries and nerves run past the elbow, so it is possible that a person may have injured them during the dislocation. Consequently, a nerve injury may result in abnormal sensation or an inability of normal distal arm or hand functions below the elbow. Children with nursemaid's elbow will not bend their elbow because of pain and may hold their arm slightly bent. An elbow dislocation is a serious injury that needs medical care. At home, put ice on the elbow. This will help with the pain and reduce some of the swelling, but the most important thing is to see a doctor immediately. The terrible triad of the elbow is a traumatic injury pattern of the elbow that is characterized by an elbow dislocation, a radial head fracture, and a coronoid process fracture. The mechanism is commonly as a result of a fall from an extended arm that results in a combination of valgus, axial, and posterior lateral rotary forces which produce a posterior lateral dislocation of the structures of the elbow. They fail from lateral to medial, and the anterior bundle of the medial collateral ligament is the last to fail. In most cases, the lateral collateral ligament is disrupted. Signs and symptoms: patients will complain of pain, clicking, and locking with elbow extension. Upon physical examination, we might find obvious deformity or varus instability. They may also show signs of valgus instability from injury to the medial collateral ligament. Elbow dislocations are very complex injuries that are difficult to treat. The injury may result in chronic instability of the elbow. Following a typical elbow surgery, the elbow is immobilized at 60 degrees of flexion for 6 weeks. Additional rehab can include hand exercises, cardiovascular endurance, isometric exercises, range of motion exercises, and isotonic exercises. A Volkmann's ischemic contracture is a permanent flexion contracture of the hand and wrist, resulting in a claw-like deformity of the hand and fingers. Passive extension of the fingers is restricted and painful. Volkmann's ischemic contracture is the direct result of an undiagnosed compartment syndrome. It is excruciatingly painful and disabling. Any fracture in the elbow region or upper arm may lead to Volkmann's ischemic contracture, but it's commonly caused due to a supracondylar fracture of the humerus. Volkmann's ischemic contracture results from an acute ischemia or necrosis of the muscle fibers of the flexor group of the muscles of the forearm, especially the flexor digitorum profundus and the flexor pollicis longus, which become fibrotic and short. This is caused by an obstruction in the brachial artery near the elbow, possibly from improper use of a tourniquet, improper use of a plaster cast, or compartment syndrome. This is also caused by a fracture of the forearm bones, which cause profuse bleeding from major blood vessels of the forearm. Unfortunately, the damage to the structure is irreversible, so the patient will be forced to live with this contracture for the rest of their life.